Turning now to news of possible drug shortages related to coronavirus. The FDA is announcing a shortfall of roughly 20 medications because of COVID-19. Now, experts say they range from common over-the-counter products like Tylenol to prescribed inhalers and anti-cholesterol meds to morphine and paralytic agents that are used in ventilators. Joining me now is David Shulkin. He's a former Veterans Affairs Secretary, former president and CEO of the Beth Israel Medical Center, and the author of It Shouldn't Be This Hard to Serve Your Country. Secretary Shulkin, good to see you again. Can you talk to me a little bit about shortages? How much of this is actual shortages of drugs needed to treat people versus the sort of hoarding behavior that people have?
Ali, good morning. This is a real problem that not enough people are talking about. We spend a lot of time thinking about, do we have enough hospital beds? Do we have enough ventilators? How are we supporting our staff? But if our doctors and nurses don't have the basic supplies to take care of patients in hospitals, we can't do the job that we need to for our patients. And so we're talking about not just the ventilators, but we're talking about the tubing for the ventilators, the intravenous fluids and materials. And we are talking specifically about these drug shortages that are increasingly getting scarce. And part of the reason is that so many of these medications are produced overseas, specifically in China and in India. And we've seen export bans from both China and India of drugs that have active pharmaceutical ingredients. That's what's necessary to produce these medications. We've seen those bans to the United States. And as you said, these are pretty common drugs in many cases. A lot of antibiotics are now getting scarce. We're seeing common drugs, as you mentioned, but specifically the paralytic drugs and the sedatives for patients that have COVID-19 that are on ventilators. If you don't have the right medications, you can't keep the patients comfortable and safe. And so this is an issue that I believe we need to be much more open about. The FDA needs to come out and tell us what these drugs are, not just that there are 20 drugs in shortage. If you can't hide these problems, we need people to be working on them, and you need to know which drugs are in short supply.
Secretary, you're also a medical doctor and you were a president of a medical center. So you've got some suggestions about this. I just want to underscore the point you make. 19 of the top 20 best-selling brands of drugs come from countries outside the United States. 34 drugs currently supplied by China have no alternative suppliers. So you've got some suggestions, including openly reporting all shortages, lengthening expiration dates of medication and supplies, sharing data, enforceable reporting, and the use of the Defense Production Act, which this administration has been sheepish about.
Yeah, Ali, I think you're absolutely correct. It is essential that we begin to start putting solutions into place right now. You can't fix problems if you don't talk about them. And this crisis has exposed some real issues in America's supply chain. And the fact that there are 34 drugs that we rely upon that have no alternative manufacturers except for China have really revealed these shortages and the problems. And so I think that the FDA needs to let us know exactly where we are on these shortages. New Zealand, as a country, reports these openly, and transparency, I believe, is the best policy. And then we can start developing sharing programs. Once we know what's in short supply and what's available, hospitals around the country could begin to share this to help patients that really need these drugs the most. But you mentioned this Defense Production Act, and we know that the president has used this for ventilators. It now appears that we have plenty of ventilators and more coming. But when it comes to diagnostic testing that we still need more of, when it comes to these common supplies and these medications that are putting Americans at risk because we don't have them, that's really the time to consider and to start taking action to use the Defense Production Act to get our manufacturers going so that Americans have what they need at the time that they're sick.
Secretary Shulkin, good to see you again. Thanks. As always, Secretary David Shulkin is a former Veteran Affairs Secretary and the author of It Shouldn't Be This Hard to Serve Your Country. It's always appreciated that you join us to make things clearer for our audience.